All right, Dad. Well, thank you so much for being here and for sharing your medical expertise and insights about Kelp. As you know, you have been foundational to HartSpan since the very beginning. Now, with all of your years as a chest physician and your emphasis on prevention and healthy lifestyle, I'd love for you to share just how common and impactful issues like acid reflux are in patients that you see.
Well, acid reflux is a problem that I see virtually every day for the last 30 years. And if you think about your high school biology, remember that the problem begins with the production of stomach acid, which we all produce. It's integral to breaking down foodstuffs so that it can be absorbed into the bloodstream. Now, the problem with that, there's a couple problems. Number one, the chemistry of gastric acid dictates that it's a very caustic substance. In other words, it creates a very intense inflammatory response outside of the stomach. Problem number two is that if you remember your high school biology, the stomach is a pouch and it's attached to a tube, which is called the esophagus. Now, stomach acid is produced in the pouch, and as long as it stays in the pouch, it's protected, the stomach is protected against the caustic effects of this stomach acid. However, once the acid escapes from the stomach, whether it's downstream or upstream, it can cause problems. Now, if you think about the anatomy, I mean, if you're producing excessive amounts of acid and you tip the system over going to sleep at night, since we don't have any type of a valve that prevents that acid from coming upstream, the acid can actually be reflux into the esophagus and cause problems.
And what about the esophageal sphincter?
Well, we refer to esophageal sphincter like it's a device. Well, all it is a thickening of the muscle at the end of the esophagus. And it has to remain open because if it were closed, you'd have a problem swallowing food. Remember, we have to have food going this way, but the acid can come this way, which we don't want. Once the acid comes up into the esophagus, it can cause problems that you don't normally associate with acid reflux. I found patients over the years denying that they have reflux and because they don't have heartburn. Of course, that has nothing to do with the heart whatsoever. This acid can, because of the acidic nature, can cause all types of problems that you can really aggravate interrupt your lifestyle, if you will. It can cause chronic cough. It can cause atypical chest pain. It can cause congestion of the upper airway. And it can even result in aspiration of this acid into the lungs, which is a very fragile organ, and cause and or aggravate asthma, which can cause progressive shortness of breath and reduction in exercise tolerance. So it can be a very rate-limiting factor to your entire lifestyle.
So it sounds like this can cause pretty serious issues.
Well, again, the symptom that I often see is the nighttime cough. It can actually disrupt sleep patterns and cause chronic fatigue the following day, which interferes with activity levels and with work performance. The chronic cough is something that it can be quite aggravating in a person's lifestyle, and it's often treated with over-the-counter medications or more potent medications that reduce the cough reflex, which we don't really want to do. So then it becomes a problem where you're kind of chasing your tail, trying to suppress this cough reflux, which turns out to be often related to a treatable problem, that is acid reflux.
And would you say that acid reflux is commonly misdiagnosed?
Well, it's often misdiagnosed or undiagnosed. And the reason for that is because in the medical education system, we're not really focusing on reflux. And I'm not quite sure why. I've been involved in the medical education for over 30 years. And even with the first year medical student all the way through to medical practitioners, we often just don't think of acid reflux as a cause of these chronic problems. Mainly because we teach the medical students to focus on life-threatening problems, often at the expense of overlooking these common problems that just make your life miserable. Therefore, if we don't teach the medical students, they grow up to be doctors, and they often overlook acid reflux as a cause of the cough, chest pain, asthma, etc.
And how common would you say acid reflux, GERD, heartburn is?
Well, Over the last several years, I've begun to think that everyone has reflux at some point in their life. It has to do with the type of food they eat, with their body weight, with the stress levels, with the exercise program, etc. Because it has to do with the amount of acid being tolerated in the stomach, if you will. And if you overstep your bounds with that threshold, you begin to experience reflux, which I think everybody does at some point in their life.
So it sounds like you see acid reflux and issues that stem from that quite often in your patients. What has your personal experience with acid reflux been?
Well, I've actually been experiencing acid reflux for probably over 30 years now. For a number of years, I had a nighttime cough that remained undiagnosed. I began using a number of different techniques to suppress the cough, and then began realizing that it's probably something else that I hadn't thought of. So I then began using over-the-counter medication, which that time actually was prescription. And it actually suppressed the cough, which meant that it was probably related to acid reflux. I then began using the medication along with an antacid type combination over the years. And I realized then that as the symptoms got worse, that we were going to have to take a new approach to the treatment plan. And that's when I realized that we needed a new approach to the treatment of this problem for both myself and my patients.
Now, Dad, what are the standard methods of treatment and how do they work?
Well, we always teach the medical students that you start off treating the problem once it's diagnosed with this group of medications we call H2 blockers, which actually reduces the production of stomach acid. And then to treat the symptoms with the over-the-counter antacid treatments, which actually neutralizes the acid and makes it less aggravating and caustic to the upper airway. The PPIs, the protein pump inhibitors, are a more recent approach where it actually uses a different mechanism to reduce stomach acid production. Both the H2 blockers and the PPIs reduce the stomach acid production, which, as we talked about earlier, is necessary for in the digestive process for the food that you eat. So we don't want to reduce acid production too much because you're going to interfere with digestion, but if you don't do it enough, you're going to experience acid reflux. And then, of course, we supplement that approach with the use of antacids to neutralize the acidity of the stomach acid. And then in severe cases, there's actually been a surgical procedure developed that tightens up the esophageal sphincter in an attempt to reduce the reflux of stomach acid in severe cases.
Now, why wouldn't you prescribe these treatments to your patients or take them yourself?
Well, there's a couple problems. Number one, just as a general rule, taking one medication every day is often not a good idea unless you really have to. All medications are foreign substances and they are all associated with side effects. The side effects vary with the individual, but suffice it to say, the longer you take them, the higher the dose, the more likely you're going to have unacceptable side effects. So that's true for both the H2 blockers and the PPIs that reduce the production of stomach acid. Now, with the antacids, there's a couple of problems with that approach. It does work momentarily, but it's pretty much a Band-Aid approach. What you're doing is neutralizing the acidity of the stomach acid, which again is needed in the process of digestion. And the second problem is that particularly in severe cases where you're taking too much of the antacids, you're absorbing that substance into the bloodstream, which alters what we call the acid-base balance of the blood, which can interfere with all types of enzyme systems that are not good for the normal physiology.
And what about surgery? Would you suggest that to your patients or consider it yourself?
Well, the surgery is a relatively recent procedure that's been developed in an attempt to treat these severe cases. The problem is that the procedure itself involves tightening of the distal end of the esophagus. Now, keep in mind that we're not only dealing with reflux of acid coming up, but we have to deal with food going down. And in the few patients that I've referred for a surgical procedure experience a problem swallowing. Not swallowing, but the food actually getting stuck at the distal end of the esophagus because the esophageal sphincter is actually too tight. So you're only going to use that in severe cases, and then it reminds one that virtually all medications and surgical procedures are going to be associated with long-term complications in a certain segment of the population.
So it seems to be a risk there.
Correct.
Now, what are some of the most impactful or important lifestyle modifications that one can use to combat acid reflux, and especially to pair with Kelp in their treatment process?
Well, there's a couple things that can be done. What we've said for years is elevating the head of the bed or getting a larger pillow. In other words, anything to keep the head above the stomach, if you will, to prevent acid from coming backwards. That's number one. Is
that pretty effective?
Well, it usually doesn't work very well. It might help a little bit, but my own experience has been, it's been minimally effective.
Okay, but worth trying, it sounds like.
Correct.
Okay.
The other thing is the timing of the nighttime meal. In other words, the worst thing you can do is eat dinner and go to bed. Now, some people are gourmet cooks and they're from Europe and they eat late at night. That usually doesn't work very well in the reflux population because, remember, you eat food, stimulates production of acid, the acid comes up and you experience symptoms. So what we're now recommending is you're going to want to eat 3 to 4 hours before you go to bed. The other thing you want to prevent is overeating, and you don't want to eat too many spicy foods for a late dinner. The other thing is that's often helpful in this attempt is to take a walk. Take a walk before bedtime. It's not terribly effective, but it helps food go downstream and acid go downstream instead of coming up. In other words, a walk around the block at night or two or three blocks often have that meal that you've eaten a couple hours before go down into the small intestine instead of coming up into the esophagus. The other issue is the body weight. Keep in mind that a larger abdomen presses on the stomach and it can promote more reflux. And if you can get rid of the size of that abdomen and reduce it even minimally, you can release a certain amount of pressure on the stomach and prevent reflux. And of course, the last but not least is the stress levels. Easier said than done to control stress, but there's a number of studies that have shown that the stress in one's life increases the production of stomach acid that may promote acid reflux.
So to recap, it sounds like the most impactful things that you can do in combination with something like Kelp is to eat 3 to 4 hours before bed, try elevating your head while you sleep, although it may not be as effective as it's touted to be. Take a walk around the block, or I assume you can just march in place if you don't have access to the outdoors before bed. Control your weight, and like you said, easier said than done, but control your stress as much as possible.
Correct.
All right, there you have it. Now, why would you recommend Kelp specifically for anyone suffering from either occasional or chronic reflux, and especially those looking to avoid taking medications for the long term?
Well, the primary advantage to an approach like this is that you're not really interfering with the production of stomach acid. You're not neutralizing it, and you're not reducing the production of the amount. So what you're actually doing is providing a physical barrier to prevent the acid from coming up into the esophagus without interfering with either the production of stomach acid or the action of the acid.
And why is Kelp unlikely to cause side effects if it's taken long term?
Well, if you think about the origin of kelp, it's actually a vegetable product that it's not absorbed. It has a high content of what we call cellulose, which is actually an ingredient that's in grass, if you will, that it's too large of a molecule to be absorbed into the small intestine. So it actually passes, for the most part, passes through the intestine without being absorbed into the systemic circulation, thereby limiting what we call systemic side effects in other organ systems.
Could you explain for us exactly how Kelp works? Now, we talk about this floating gel barrier that sits on top of stomach acid and prevents acid from traveling into the esophagus. But why is this so physiologically effective?
The Kelp product is going to be expanded once it's swallowed, and once it gets into the stomach, it's going to be expanded into this layer that's actually physically preventing the reflux of acid into the esophagus. So it's kind of taking the place of what we would call a flap on the distal end of the esophagus, if you will. You're kind of plugging the hole, if you will, to prevent the acid from coming upstream and causing all these symptoms that patients can experience for months or years.
So sort of like a floating cork.
That's a good way of looking at it, yes.
Now, we're proud that Kelp is an MD-backed solution. And as our medical advisor, also my dad, obviously, what specific aspects of Kelp, from its formulation to the science to the study results, gives you the confidence to stand behind it so strongly?
Well, as a medical practitioner who sees side effects of medications all the time, I'm particularly pleased with the fact that it's confined to one organ system and it's not absorbed. That's the biggest problem with any type of medication that you're taking on a regular basis.
The results from our nationwide study were so encouraging, 81% experiencing benefits within that 1 to 4 day range, 88% getting full symptom relief, and 70% rating Kelp more effective than even prescription medication. Now, as a physician, what was your take on these findings and how significant are they?
Well, any type of study that provides objective data as to efficacy is always not only beneficial, but it's instructive. What it tells you, this approach does work without all the systemic side effects associated with various medications. If you think about the approach to a large sample population, once you get over 50 or 60% efficacy, you're in pretty good shape. So those are actually pretty good numbers when you look at a large population, a population including large numbers. So I'm actually quite comfortable with that type of database.
Were you surprised to see that people were rating Kelp as either as effective or even more than their current treatments, including prescription medications like PPIs?
I wasn't surprised at all. Again, patients don't really want to take medications every day, and therefore they don't. And when they don't take the medication, they get symptoms. And then it becomes kind of a source of aggravation. That's one problem. The other problem is patients are often undertreated. I think that one study showed that almost over 30% of patients with acid reflux are undertreated. In other words, one size fits all. Well, of course, that never works because the amount of acid produced by any one individual over time varies considerably. So again, very reassuring data.
Have you found any other natural treatments without these long-term side effects that are as effective as Kelp in your experience?
You know, I've actually kept my eyes open for a non-medication approach for 20 or 30 years. And I really haven't found anything that really works very well. And again, this is kind of a new approach that's, in this country anyway, I think it's been around in Europe and Asia for a number of years, but in this country, I think it's been a relatively new approach that's been surprisingly effective.
And what are some of those natural treatments that you have tried for yourself or with your patients? I mean, we see things like slippery elm supplements or natural herbs that soothe or coat the stomach. We see things like licorice root, even just mixing baking soda and water. But what are some of the treatments that you've seen that maybe have not been as effective in your experience?
Well, the ones that I've seen over the years, they've had no objective database behind them. In other words, they've really never been studied effectively. The second problem is the mechanism of action, in my mind, has always been kind of questionable. I've never really found any of them to be effective or even worth trying. The baking soda in the water, that's kind of an old approach that goes back to the 1950s. And again, it's pretty much of an antacid approach. So it's the same problems associated with modern day antacids. But in answer to your question, I really haven't found any natural substances over the years that have been effective in treating acid reflux.
Yes, until we created Kelp.
Yes.
For people with specific conditions, let's say hiatal hernia or gastritis or hypothyroidism, what is your general medical advice about using Kelp?
Well, the first two have to do with gastric hyperacidity, the excessive production of acid. A hiatal hernia is actually basically an anatomical abnormality that's so common it's not even an abnormality, I think, in the normal population, that increases the reflux of acid due to a more lax esophageal sphincter. So the Kelp would actually be a treatment of choice, as it would be with gastritis, which is generally the result of the overproduction of stomach acid. As far as some of the thyroid problems and the other systemic problems, that's generally not going to be impacted by Kelp, though when in doubt, ask your primary care physician.
And is Kelp safe to take when you're using other prescription medications? And what sort of general guidelines should people follow when considering pairing Kelp with other medications they're currently taking?
Well, the interaction with other medications should be minimal. Again, this is biology, anything's possible. But the probability of some substance like Kelp interacting with any type of medication that's prescribed by your doctor is very minimal. Again, if you think about the mechanism of action, you're forming a physical barrier, and chemically it's not really reacting with the other medications that are going to be present in the stomach. And therefore, it's probably, you never say never, but it's very seldom going to be an issue. But again, if you have any doubt, ask your primary care physician.
Could you comment on testing for reflux and how you make that diagnosis?
Regarding testing for reflux, it's in kind of a gray zone because most doctors are not ordering the appropriate test. Why? Because we're not teaching medical students to order the old-fashioned upper GI x-ray. It's something that it's a low-cost procedure. It doesn't always make the diagnosis. What that means is that it can be a negative test and you still have symptoms. That doesn't rule it out. That just means on that particular day you didn't have reflux. Then the other problem is that often patients get referred to a gastroenterologist for what we call upper GI endoscopy, where the gastroenterologist is actually looking down with a fiber optic scope, but you can't see acid. Acid is clear, it looks like water. So all you see is redness. So it's kind of an indirect diagnosis to begin with. So in summary, we're not ordering tests to begin with. Most of the time, doctors are often just treating it based on symptoms. And second of all, they're often ordering the wrong test. They're either not ordering the upper GI or they're taking the negative upper GI as evidence that I don't have acid reflux, which it doesn't really rule it out. So even in patients where it seems like they really do have acid reflux with a normal upper GI, what that simply means is it's probably not real severe. And then by the time they get referred to a gastroenterologist, they've had the upper GI endoscopy, which often doesn't show reflux. So the testing is a problem because the next step is more advanced testing, which means that you're swallowing a little device that measures gastric pH, and it gets more complicated. But suffice it to say, testing is going to be a problem, and a lot of the times it's negative even when you have, quote, silent reflux, yes, or regular reflux.
We made a very conscious decision for Kelp to be free from dyes, artificial sweeteners, flavors, synthetic fillers, and really just to focus on the highest quality and pure ingredients for it to be effective. From your medical perspective, why is avoiding those kinds of ingredients or additives generally beneficial, especially for people who might have digestive sensitivities?
Well, the reason that's important is because you're dealing with biochemically, you're dealing with a single molecule, basically. You've got very few additives that might be absorbed into the systemic circulation that might cause hypersensitivity, allergic reactions, other side effects, and et cetera. Like I said, that molecule is not absorbed into the systemic circulation, simplifying the the problem considerably because you're not dealing with other substances that you really don't know the long-term impact for.
Why is it important to get the dosing right when taking Kelp?
Well, back to the mistake we often make with medications, one size does not fit all. In other words, if you produce a little bit too much acid, a single dose might be effective. If you produce 2x, a single dose won't be effective. 3x, you're probably going to have to adjust the dose accordingly and not fall into the trap of taking one, if you're a severe refluxer, taking one dose and saying, well, it doesn't work. Well, it doesn't work because you're overwhelming the system with the amount of acid you're producing. So you have to adjust that dose accordingly. And what I like about this approach is that you don't have to worry about overdosing because, again, that molecule is not absorbed in the systemic circulation. You're limiting it to the GI tract, which usually almost never causes any significant complications.
Will Kelp work for everyone?
Well, I always teach the medical students, you never say never and you never say always. So the answer is no, it's not going to work for everyone. These are complex biological systems, and the individual variation within a population of 1 million people is considerable. So are you going to impact the majority of that group? Yes. Is there going to be a small segment of that population that are going to have a problem? Yes, because they have problems with other things too. You're not going to solve the problems of everyone with one substance, no. But in general, it's going to work pretty effectively in the normal population.
How should someone with severe chronic reflux take Kelp differently than someone who has more occasional reflux symptoms?
Well, patients with chronic reflux are going to be a challenge to begin with. If that pretty much puts them into the moderate to severe category, and you're probably going to end up taking 3 or so of those capsules per night. If those patients don't respond, you're probably going to end up having to add one of the H2 blockers like famotidine, which has a lower incidence of side effects than the PPIs that are often prescribed. There's one of the over-the-counter agents that have famotidine and a small dose of an antacid. So that combined with the 3 Kelp at night are generally effective in most, but not all, of the severe overproducers.
So who would you say would benefit the most from taking Kelp? Who'd you recommend it to?
Well, the groups that you're going to have most of an impact with Kelp is going to be the slight to moderate group that you're going to have most of an impact on, and less of an impact on the severe overproducers. You're going to impact a small percentage of them, but not all of them. And I'm reasonably certain that you're going to have a significant impact on most, if not all, of the slight to moderate overproducers.
And how can someone tell if they're slight, moderate, or severe producers?
Well, the upper GI x-rays will help to a degree. Not always, but if you do an upper GI that shows severe reflux, you know you're in that category. If the upper GI is negative, it shows nothing, you know you're in the slight category. The moderate group will have intermittent findings that will bounce between slight and severe. But then the other way that you can tell is just the response of the symptoms to the supplement. If you have no significant response with 3 or more per night, you're probably going to be in that severe category. And if you did the upper GI in most of those patients, you're probably going to have significant reflux demonstrated radiographically.
So Dad, considering all of your knowledge, the science, the clinical studies, Kelp's natural formulation, what is your overall professional assessment of the role that Kelp can play in managing acid reflux safely and effectively?
Well, I'm going to say that Kelp is going to be, in my mind, considered a first-line therapy for acid reflux, particularly that slight to moderate category. I would have no problem at all starting those patients on Kelp before they would use either chronic antacid therapy or the pharmacologic approach. Again, I'm quite comfortable in starting them and increasing the dose accordingly based on the response to symptoms without worrying about long-term effects or affecting other organ systems.
So would you recommend for those people who are currently taking medications like PPIs or H2 blockers, maybe have been for many years now, to try to transition off of those onto Kelp?
Well, that transition from persistent use of prescribed medications to an alternative can be done gradually. What usually works fairly well is to start the supplement, the Kelp, in addition to the prescribed medication, and then begin to taper the dose and eventually discontinue the prescribed medications if symptoms would allow that. Keeping in mind that your goal would be to, number one, reduce the dose of prescribed medications, and number two, to discontinue those medications in its entirety in favor of using the supplement like Kelp on a daily basis.
And if you were talking to your medical colleagues about Kelp, what would be the key differentiators or benefits about this natural MD-backed functional supplement that you'd really want to highlight for them?
Well, the highlight that I'd want to spread in the medical community is there is an alternative to prescription medications that are almost always associated with long-term side effects if used in a higher dose or for a long period of time. In other words, there are alternatives in addition to what we just teach you in medical school.
Well, thank you so much, Dad. That is incredibly important for people to hear directly from you.
My pleasure.